My name's Pat, and my family's lives have completely changed due to an overdose. I was a straight A student, varsity athlete every year, and my brother was struggling with addiction. He got hurt at work, got addicted to Percocets, he couldn't deal with the pain, switched over to heroin, it was cheaper, and then the cycle began. But after his passing, everybody was asking me what was going on, what happened to your brother, what happened to your brother? And we were so caught up in it that we were ashamed. It was the hardest thing, and it sucks to say that about, losing your family member. As much good as I try to do, there's always this stigma and this whole, it's all drugs, it's all these people who want to kill themselves, it's this and that. It's like, no, it's not. An overdose can happen to anybody at any moment. This isn't just a choice.
Addiction shouldn't define anyone. Support helps, stigma hurts. Take the first step in breaking through the stigma of addiction at sosberks.com/addiction. Paid for with Pennsylvania taxpayer dollars.
Hi, my name is Kristen S., and I've been in recovery for 11 years, 3 months, 14 days, and probably a couple hours by now, but who's counting? For me personally, the alcoholism and the addiction started, the day I was born. It's a disease, it's a genetic thing. I didn't want to rely on alcohol or drugs, but it was a compulsion that I couldn't stop. I survived on, alcohol and drugs for 20 years, from the age of 15 to the age of 35. The stigma, I always say to people, do I look like a junkie? Is this what a junkie looks like? It doesn't look like what people think that it looks like. The disease it's a ghost. It has no real face. So I think we have to personalize it instead of generalize it, Everyone deserves a second chance. I deserve a second chance.
Addiction shouldn't define anyone. Support helps, stigma hurts. Take the first step in breaking through the stigma of addiction at sosberks.com/addiction. Paid for with Pennsylvania taxpayer dollars.
My name is Edwin, and I've been in recovery for 6 years. I was so sad, I was miserable. At that time, I would get drunk and cry myself to sleep, complaining to my girl that I didn't want to die of consumption. I was a functioning drunk. I don't know who coined that term, but it doesn't make sense, because if you're drunk, you're not really functioning. I came to a point in my life where I knew I had a problem and I couldn't stop. I didn't know anything about the 12-step programs. I didn't know anything about detox or rehab. Nobody asked me, do you want to go to detox? Do you want to go to rehab? So when I got into the 90-day program, I just was ready. I was sick and tired of being sick and tired. I hit a bottom and I just was ready to put in work. I love life even on the good days. I'm just happy to be on this side of the grass, because if I would have kept doing what I was doing early in my life, I wouldn't be sitting here.
Addiction shouldn't define anyone. Support helps, stigma hurts. Take the first step in breaking through the stigma of addiction at sosberks.com/addiction. Paid for with Pennsylvania taxpayer dollars.
Just about all of us know someone who's struggling with addiction.
Opioid and other substance use disorders can affect anyone.
All too often, our family members, friends and neighbors in Berks County suffer in silence.
Words of encouragement, hope, and support break through the negative perceptions that prevent people from seeking help.
Support helps, stigma hurts.
Take the first step in breaking through the stigma of addiction at sosberks.com.
Paid for with Pennsylvania taxpayer dollars.
My name is Ryan, and I have been in recovery for 14 years. In 1984, my son was born, I was stabbed in high school, and my mother died, all in 1 year. That's when my addiction really took off. I progressed deeper and deeper into active addiction, not understanding, the disease of addiction. I ended up doing 10 years. I went in when I was 19. I got out when I was 29, and I came home, and I started using. So when I came here to Berks County, I really know what to do. I had no life skills, I had no job skills. You know, everything that I knew from the hood, so to speak. Coming here and being introduced to a program, it was like, wow. You know, and so I started going to meetings. You know, I did get a sponsor, and I relapsed. After 5 years clean, and 4 years had passed, and I relapsed again. And on his third trip, like when I say I surrender, like I surrender everything. I surrender everything. Today, I consider myself a hope dealer, not a drug dealer. I consider myself a hope dealer. Today, my life is serene.
Addiction shouldn't define anyone. Support helps, stigma hurts. Take the first step in breaking through the stigma of addiction at sosberks.com/addiction. Paid for with Pennsylvania taxpayer dollars.
My name is Robert, and I have 10 years and 5 months of sobriety. My mother and my father were addicted to drugs and alcohol, and the environment was very violent. In 2008, my addiction really took over, and my wife at the time, she wanted me to leave, so we separated. That word, hitting rock bottom, that phrase is real. It really hit me. I started to learn about the recovery world really when I was in prison, in what they call therapeutic communities. I mean, I yearned for change, but I just gave up. The life that I have now, oh man, I won't compromise. I am a person who's willing to help others understand the stigma, right? Understand addiction, but also understand that recovery is possible.
Addiction shouldn't define anyone. Support helps, stigma hurts. Take the first step in breaking through the stigma of addiction at sosberks.com/addiction. Paid for with Pennsylvania taxpayer dollars.
And I just want to thank everyone for taking the time to come here today and join us for this online event. Stigma is an important topic, and we're grateful to you for your willingness to learn more about how to communicate in ways to reduce stigma. We're going to get started with a brief overview of our Stigma Reduction Project and our Stigma Reduction Media Toolkit. And then we have 3 presentations lasting roughly 10 minutes each from Dr. Jennifer Murphy of Penn State Berks, Yvonne Stroman of COCA, and Tracy Hoffman from Hoffman Publishing. If you have any questions at any point, we ask that you put it in the chat, and we'll address those questions at the end of the program. We also have a very short survey that we're going to ask you to fill out at the end. We'll put a link in the chat, and we will also email it to you. And then we'll send everyone who's participating here today hard copies of the Stigma Reduction Toolkit. Okay, our first, we're going to get started with Marcia Goodman-Hinnerschnitz. She's our Director of Planning and Resource Development, and she's just going to talk a little bit about our stigma reduction campaign.
And good afternoon, everyone. And I apologize for the background noise, but we're having ambulances come through it. And I think maybe that's very timely in the fact that we're talking about a very serious public health problem, opioids and other drug addictions, and how they impact on the population. And as we look at why we've been challenged to address these problems, the major reason that we find is that there's a lot of stigma about getting people the help they need. And there's a lot of self-stigma for those suffering from substance use disorders. So we really have a challenge ahead of us. And fortunately, we have a lot of you, concerned citizens in the community, persons in recovery that are willing to join in the effort. Stigma has been a barrier to engaging individuals in treatment for decades, probably for centuries. As the opioid epidemic escalated here in Berks County and across the state and across the country, we knew we needed to be able to make the issue of stigma a priority. SOS Berks, the Berks County Opioid Coalition, mobilized its resources to address the problem of stigma, first by assessing what stigma looked like in Berks County, and then coming up with strategies. The videos that you saw at the beginning of the presentation were just one example of what we're looking at as far as getting a destigmatizing message across in Berks County. We received funding through the Pennsylvania Commission on Crime and Delinquency, and both SOS Berks and COCA have successfully launched the Addiction Doesn't Define Me, Support Helps, Stigma Hurts campaign. We recognize in implementing this campaign that substance use disorders have been stigmatized for centuries in the United States. And I'll just give you a really brief history of what we're looking at here. When we go back to the beginning of the 1900s, we see that people with alcohol use disorders, alcoholics, were stigmatized. They were described as moral inferiors. The children were even isolated. They were seen as born criminals with no ability to determine right from wrong. That had to do with alcohol. As opioids and heroin became a predominant drug, it was mainly seen as a problem for people of color, even though the large segment of people that were using opioids were white, middle, and upper class individuals. And it wasn't until the abuse of prescription opioids became a problem that it really focused our attention on what we need to do. Interestingly enough, even our federal and state legislation was stigmatizing. In 1914, the Harrison Act was passed, and it aggressively focused on criminalization of people who were suffering with addictions. And it also criminalized physicians and many of the existing treatment methods. In the late 1950s and 60s, many therapeutic communities that were established basically treated their clients in a stigmatizing way, making them sit quietly for hours before their intake interviews, and even having those individuals refer to themselves as being stupid, non-worthy. During this same period, the entertainment industry was constantly stigmatizing people. Either they glamorized drug use, but they also portrayed individuals with substance use disorders as skid row bums. And I just, the other night, was watching a movie with Judy Garland, The Star is Born, and I saw the stigmatizing behavior regarding that individual with alcohol use disorder. So it's really been embraced by our media. Interestingly enough, something that we probably don't see as stigmatizing was the war on drugs in the 70s. That war had a zero tolerance policy, meaning that no one could use drugs, and its sole focus was to criminalize as a solution to a substance use disorder. As a result, the incarceration rates as well as the substance abuse rates have skyrocketed in recent decades. And we still see some of that stigma going on as far as when we ask people to get involved in drug testing. As treatment programs were expanding, they also were faced with barriers due to stigma. Local zoning ordinances, the not in my backyard attitude, created significant barriers in bringing needed treatment to the community. In fact, here in Berks County, the New Directions Treatment Center, which is our methadone clinic, could not establish a location in the city of Reading due to community pushback. And in fact, only recently was able to establish itself in the right size facilities in a suburban neighborhood. They were really forced to basically operate out of inadequately spaced facilities. So stigma's been with us for a long time. So here in 2021, we're faced with an ever escalating opioid epidemic and ingrained negative perceptions of persons with substance use disorders. Our efforts to respond to stigma must address the generationally embedded attitudes and the misconceptions regarding addiction. So one of the tools that we've developed, and Jennifer Curlin will be reviewing this with you, is a communications toolkit. So we can get our language properly, that we don't use the stigmatizing language that has set us back for generations in being able to address the problem. So I'll turn it over to Jennifer.
So as Marcia had mentioned, this toolkit came about as part of the Stigma campaign that's been going on for a few years now. And we're really happy with how it came out. And I was part of the team that put this together. And so as Marcia had said, it's part of the campaign, and throughout the toolkit, you'll actually see that there's quotes from some people that are also part of the testimonial. So we were really intentional about the quotes that were put in, the images, and the overall content that's here. How individuals with substance use disorders are portrayed in the media impacts public perceptions, and we know from that it can hinder individuals from getting the help that they need. And so language and images have power, and it's really important for us as communications professionals to be able to see how what we're using can either be feeding stigma or can work against it. We have some background on how individuals speak about their recovery in this toolkit. Anonymity can be a little bit confusing and can be very personal for some people. In recent years, there's been an increase in individuals sharing their stories of recovery in what is coined recovery out loud, so to be recovery out loud. But that doesn't necessarily mean they're focusing on specific programs. So it can be a little confusing, and the language around the recovery community can also be different. It's important to know that for many years, the words addict or alcoholic have been commonplace, not only in recovery rooms, but also in the community. And it is still like that in some circles. Yvonne's with us, and she'll be sharing a little bit later about language and how that has affected her journey and her experience with that. Addiction is a disease. Many people view addiction as a result of an individual decision to use substances rather than the development of a brain disease. And so when we're speaking about addiction to the community and in the community, whether it's at an event or through a social media post or an article, we really encourage using information about how addiction is a disease. And so this page in the toolkit provides some resources that can help with that. We do have footnotes for these charts so you can see where they've come from. We often quote the American Society of Addiction Medicine, the National Institute on Drug Abuse, and SAMHSA, or the Substance Abuse and Mental Health Services Administration. So there's some great organizations that are really good resources to further educate the community and yourself if you need to or want to learn a little bit more about addiction. The voices of families. We found that this was really important to put in this toolkit as well. Addiction is often called a family disease, and a family struggling with extreme emotions accompanied with addiction may find it really difficult to talk about their experiences in public, depending on where they are in that recovery journey. This also applies to those who are in early recovery. We've seen some people who are very comfortable and confident to speak, and it's very easy for them to talk about their current life versus their past life. And for some, it's really emotional. So just something to keep in mind when you're connecting with individuals and their families on where they are in their journey. We do recommend people who are in more long-term recovery and more comfortable speaking about that. As you'll hear Yvonne, she uses certain language and just the way she's comfortable speaking. There's a lot of people in Berks County who also fit that, that are able to bring hope to their story of addiction and recovery. And this all ties in with the power of language. In 2017, the version of the Associated Press style book actually included an update for journalists on how to refer to people with addictions. And so in those guidelines, it was recommended that to avoid words such as alcoholic, addict, user, abuser, unless they are in quotations or names of organizations. So very similar to this chart we have here of words we suggest to not use and words to use instead in this first person language. So addict or alcoholic, instead say person with an addiction or substance use disorder, or opioid use disorder if that's appropriate. More clinical terms, drug abuser or junkie, instead say person with unhealthy or harmful substance use. Dirty or clean drug screening, instead say positive or negative screening. And on this page of the toolkit, we just have some guidelines of what we recommend. So we do recommend when reporting on addiction disorders to include the perspective that they are treatable health conditions. To portray addiction recovery as normal and attainable, as opposed to something that is an exception to the rule, emphasizing the richness and rewards of long-term recovery, and not just focusing on the individual, but also their connection with their family and their community. Differentiating between active addiction disorders, treatment and recovery, and to look for stories of long-term recovery as opposed to that are new, like I talked about a minute ago. Using positive or neutral images, just as you'll see throughout the toolkit as examples, and overall just focus on stories of recovery, which just tend to be very hopeful and positive, not negating the past, but more focusing on that aspect of recovery rather than the more dramatic details of past. And so some things that we recommend to shy away from: using certain images that may encourage the public's moral outrage. So, and images that may trigger cravings for someone. This could include graphic images such as alcohol, drugs, pills, powders, paraphernalia, people who are passed out. Also using certain language is that, saying passed out, actively using. Sometimes gambling in the context can also show stigma. And so if you have questions about these, you're welcome to reach out to us. We are still learning, but we have started to just build a way to communicate these things in a way that doesn't feed stigma. Myths versus reality. This is just some examples of something that is a phrase that is stigmatizing and how to respond in a way that is not stigmatizing. So there's some examples for you to review. And then lastly, just our sources. So like I said, we're still learning. We've learned a lot over the last few years, and we're happy to share with you this toolkit and any other questions you may have. I'll be here for the rest of the event. If you have questions, just feel free to put it in the chat. Thanks so much.
Thanks, Jennifer and Marcia. That was a really good overview of our toolkit. And our first presentation will be from Dr. Jennifer Murphy. We're really glad to have her here today. She's an associate professor and chair of criminal justice at Penn State Berks. Her research focuses on drug treatment in the criminal justice system, drug policy, and the stigma of addiction. She's been working to improve addiction knowledge and decrease stigma on the Penn State Berks campus through training sessions, as well as an on-campus media campaign that she did in 2020. So Dr. Murphy.
Okay, thank you for inviting me here. I'm happy to talk about some of the work that we have been doing at Penn State Berks. Is my screen showing? Are we good? All right, great. In partnership with COCA and using some of the resources that you just saw, we have been implementing some stigma reduction work on the campus at Penn State Berks. And some of the work that we have done so far has been funded by the Pennsylvania Department of Drug and Alcohol programs. And in addition to myself, my colleague, Dr. Brenda Russell, a psychology professor, should be recognized as well for her contributions to this work. So we have been doing a variety of activities on campus. Primarily, they have been in-person training sessions, although we have now moved to some virtual training sessions, as well as an on-campus media campaign. So I want to talk a little bit about what those different efforts have looked like and how we have attempted to measure some of the effects of this work on campus. And it is ongoing. So we are still doing this work on campus through this upcoming semester. So to look at those in-person training sessions, we started these in late 2019, and our first one was with just faculty and staff. So we did a 2-hour session for about 30 participants about addiction science. We had presenters from the Caron Foundation talk about the disease of addiction, medical model of addiction. And then we had a presentation on using naloxone from a COCA representative. So not everyone stayed for that training, but what we found that overall, those who did attend the educational sessions and the naloxone training showed improved knowledge of addiction and an increase in the endorsement of a medical model of addiction and reduced stigma. And interestingly, those who stayed for that naloxone training had an even greater improvement as far as lowering their stigma scores versus those that did not. So one of the pieces of that toolkit, like you just saw, was about the stigma associated with using naloxone. So it is positive that by doing naloxone trainings, we can be reducing stigma toward people with substance use disorder. We then took this training and revamped it a little bit based on what we did in that December event for students. So we had space for about 40 students to participate in an in-person training in February of 2020. And we targeted students who were majoring in criminal justice, psychology, and rehabilitation and human services. We targeted these students in particular because we saw these students as possibly going into careers where they would be very likely to encounter people with substance use disorder. Criminal justice students, many of whom want to go into law enforcement or probation work, rehabilitation and human services. They want to go into kind of case management, social work kinds of positions. So that's why we targeted that group. We increased the time of the session to 3 hours. So we were also able then to include guest speakers who had lived experiences with addiction and recovery. So the research on stigma reduction shows that one of the most effective ways to reduce stigma is to expose people to those who are in recovery, who have had some success in treating their addiction issues. So we were able to include that. That was something we did not have in that December 2019 session. We also had some speakers talk about local efforts like the Warm Handoff Program, Blue Cares, as well as then a naloxone training by that representative, again, from COCA. And students were given then naloxone kits to take with them. We did a pre-test before the training session and then post-test right at the end. And we found that we did see improved knowledge, improved attitudes toward addiction, reduced stigma after the educational session. And we had a control group of students who did not attend the session that we were able to collect the same survey information from. However, unfortunately, we weren't able to survey them again later on in the semester, which was the plan because we had shut down the campus due to the COVID-19 pandemic. So we weren't able to collect that follow-up data for the students who did attend the training to see what maybe those longer term effects of training would be on sustaining that reduction in stigma. And we weren't able then to look at our control group again later as well. So that was some of the limitations of that research. But we are encouraged by the results that we did see. And one of the things we also did see was that the largest effect was knowledge and comfort using naloxone post-training. Virtually none of the students in these training sessions had had any previous experience using naloxone. So it was really encouraging to see that in a relatively short presentation about naloxone and how it works, they felt comfortable that they would be able to use it if they had to. So this has led us now to doing some virtual trainings. So we began video recording of speakers who did these in-person sessions with us. And we have created a virtual training. It's about 1.5 hours. And we are now making this available to multiple Penn State campuses. We were a little bit behind this past semester in getting it rolling. So we didn't have enough data really to start looking at the effects on stigma reduction for those who have done it so far, but this will continue into the fall semester on multiple campuses. So hopefully we will get a large group to look at. And that includes also Penn State Hershey. So we'll be reaching some students who are going into medical, health professions as well. So the other part of the work that we've been doing, we did an on-campus media campaign. And this involved, we had students create materials. They incorporated a lot of the materials from COCA in those flyers, and we put lawn signs, sandwich board signs around campus. In various buildings, we have television screens. So we were able to show some stories, some people speaking about their recovery experiences. Those were from the Share Your Opioid Story series that was collected through Penn State Abington. We had some information posted on the Penn State Berks website during that campaign. So we had students complete a pre-test survey about addiction and attitudes toward addiction and stigma levels before the campaign started. And then we put the materials around campus for about 5 weeks. And we had about 8 different flyers and signs that would get rotated and changed around campus. So we were trying to increase exposure of all of the different materials that we had, and hopefully, change them enough that people weren't just seeing the same thing all the time. Just to show you a couple of examples of the flyers, we had information about resources that people could access if they needed to be evaluated or receive some kind of treatment. We did have a big focus on that language piece, which is important about educating people about words to use and words not to use when talking about people with substance use disorder, people who use drugs, and trying to be mindful of that. So that campaign, like I said, went till the end of October, and then we did post-test surveys, trying to get information from the same students who took the pre-test survey. And we did see some positive effects of this campaign in terms of increased knowledge, openness to treatment, reduced stigma. And also the fall semester, though, was a little bit different because not all students were on campus. Many of our students were only attending classes virtually during the fall semester. So we were able to capture that as one of the variables in our survey. And we found that students who did do on-campus work showed reduced stigma at a higher rate than students who were just doing virtual classes at that point. So we are trying to be able to attribute that then to the actual campaign and the presence of being on campus and witnessing those materials. So like I said, the work is ongoing. We're continuing with those virtual sessions. Perhaps we'll try to do the media campaign again in the future now that we have more students on campus and we can reach more students with these messages. So I will end my presentation there.
Okay, well, thank you, Dr. Murphy. That was a really interesting presentation. Our next presenter will be Yvonne Stroman. Yvonne, for more than 25 years, has worked in the field of social services, providing leadership, support, education, advocacy, training, and empowerment to individuals, families, and communities. She currently serves as a community program specialist at COCA, and she wears a lot of hats. I can't even begin to tell you how much she does, or we would have to extend this program. But she's going to speak to us today about her own recovery experience and how language and stigma impact people in recovery or seeking treatment. Yvonne?
Thank you, Laura. And just want to say thank you to those that carved some time out of their busy schedules to join us today. I really think that this is something that is really worthwhile, and I think it's an opportunity for all of us to kind of learn from one another. So I just wrote a couple thoughts down that I wanted to share with you. And feel free if you have any questions afterwards. I'd be more than happy to talk about my journey and recovery. So many of you would agree that the magnitude and power that the media can wield sets the tone for how we see the world today. Someone once said, the media has the power to create a perception that is incorrect and people will believe it. And I think about the media, I'm sure that many of us would agree that when we take information from the media at face value, and some of us do so without even fact checking. So that just gives you a small indication of the power of the media. And I don't know about you, but as I understand it here today, when we provide information to the media and the importance of shining the light on the face of addiction, it really can be in a way that how people can view this as a public health crisis versus something that is morally wrong or derelict with all of us. And, you know, I also need to just kind of mention that as a person in long-term recovery, I'm not a bad person getting good, I'm a sick person getting well. And I think that when we can look about the wellness of individuals and the opportunity for people to get well, and when we can report that in a positive light, I think more and more people would come forward. So I'd like to just kind of share a little bit about how the media can do a great deal of good as influencers, even within the scope of the professions that we also see in the spirit of having a lot of power. Long time ago, I was struggling with my own disease of addiction. In fact, I can recall a time in my life when I was in an emergency room, and I can remember not feeling well. I felt panic, confusion, some disorientation about what was going on in my life. At that time, I was going through withdrawal, but I didn't know that. So instead, I took myself to the emergency room and just told them that I didn't feel well. There was some kind of questions from the doctor. I smelled of alcohol. And so I did profess that perhaps I was abusing alcohol. I shared with him that I might be an alcoholic and even a drug abuser, but that I did not have an addiction to drugs. And he shied away from further conversation, though, that might have gotten me access to detox, and instead just kind of said, well, you seem to be healthy. You're not necessarily in harm of hurting yourself. So maybe you just kind of need to go home and sleep it off. And I really just kind of left there feeling no more information than what I had other than what I told myself. So I really went back home and continued to use. And then subsequently, I experienced what many folks who have a substance use disorder does, and that include loss of home. So I was homeless for a little bit. I had lost my job, lost family distrust, and I was really embedded with a lot of hopelessness. And in fact, I was just one of those folks that felt as though I was on a path to self-destruction, and okay, that's my lot in life. I really didn't care. But as I got well and began to think about those moments in life where perhaps there could have been some intervention, I sometimes wonder how that interaction might have been different had the prominent exposure of the disease of addiction through the lens of the media would have changed the perception about myself as well as the doctor. When talking about myself, I never thought of myself as someone who was an alcoholic who had a drug problem, because the media portrayed someone who was an alcoholic or an addict as somebody who was living under the bridge, cloaking and snuggling with their bottle of wine, and that wasn't me. And so that media perception about what an alcoholic looks like, or someone who's a drug addict as being in the street, holding up a sign saying, I'm homeless and help me out, that wasn't me. And so again, I disassociated with perhaps having a substance use disorder because the media kind of told me different. So I guess I sit here to say that the media in its power has the ability to mold and shape what the disease of addiction can look like for folks, whether it's through the stroke of a pen, whether it's through the visuality of a camera, whether it is through common conversation. And I just think that as I see Bill Saunders, who is a person that I can think is a proponent for healthy conversations around this topic. I think if we had more Bill Saunders in our community, that this would be a great thing, because he comes from a perspective of wanting to learn, and he'll ask questions and positions it in a framework and a light that people really want to have that conversation. And so I think about that, and I think about my journey and these opportunities and how we can all grow and learn from one another in a spirit that can be uplifting and also in a spirit that can save lives. And so today, when we can have access to that type of information, we don't necessarily see individuals as that derelict or that something that needs to be kind of gotten from the society side, but instead it could be someone's loving father, a caring grandmother, a dedicated teacher, or even an informed psychiatrist who really just wants to find out how they can get the help that they so desperately need in a loving and compassionate way. And I think that that would change the way that we look at the face of addiction. So what we do know is that we live in a world where our hearts stop and beat according to the writing, voice, and pen stroke of the media. As we embrace the opportunity to be of good service, I ask that we take into account that human lives matter. It means a lot for me today when I say I'm a person in long-term recovery, and that it prides me to say that I have 31 of uninterrupted years of long-term recovery. Words like addict send a message that can be harming to an individual, and it also paints somebody as a bad person. It also, words like junkie, alkie, stonehead, tweaker, they all send a message of derelict and no good, when in fact the matter is, it's the disease of addiction is about the state of the brain and health, not of someone's character. I can share with you that I have been in the company of people who refer to themselves as an addict or junkie, but that's because they wear that badge to remind themselves of where they came from. As responsible members of the media, we can even help the recovery community change how they see themselves and how others see this as well. What we know today and what I know today is miracles can happen when we change the perception of our own reality. So I say, see us, hear us, and know that we are people too. And lastly, I'd just like to say, the more that we can talk openly about the disease, much like we do about diabetes, high blood pressure, and other health conditions, the more we can provide supportive and meaningful pathways to greater understanding and a greater chance of saving lives. So I just want to say thank you again today, and thank you for allowing this platform to be as it is. And let's continue the conversation where we can learn from one another.
Well, thank you, Yvonne. That was really great. That gave us some really good insights into stigma. Our next speaker is Tracy Hoffman, and I believe Marcia will help introduce Tracy.
Hey, thank you. And thank you, Yvonne. In our journey to move towards destigmatizing the understanding of substance use disorder, we were able to partner with Hoffman Publishing to be able to produce a publication called The Response. And it was interesting because we all come from our own points of view, but what's important is as we journey together, we learn to be able to look at what can be stigmatizing messages and what can't be. And I know when Tracy came to the table to work with SOS Berks, I think he can tell you his story and what he learned about stigma and how we needed to make sure that every publication of The Response really helped to look at stigma and how it helped to address it. So Tracy, and then we're going to be sharing some great things as part of our journey with you. Tracy?
Great. Well, thank you. Thank you for allowing me to share today and be part of this very important work. We've been fortunate to have the opportunity to work with the Council on Chemical Abuse and SOS Berks in this journey. And speaking for myself as a 40-year professional in the field of communications with solid years of experience working through journalism, marketing, and latter stage career publishing, it's been very eye-opening to see the paradigm shift between the use of stigma words and where we are today in the world of recovery, and what we've learned. And so speaking on that 40-year journey and alluding to some of Yvonne's comments, one of the biggest things in media is always how quickly can you get the audience to recognize what the subject matter may be, and hence the more sensationalized photos, the more sensationalized words gets somebody into a story quickly. And the unfortunate part is, yes, it gets readers pulling into the sensationalist approach, but does very little to educate, probably more polarizing for those who have a defined judgment of whether it's a right or wrong attitude, or a good or bad person, or that type of environmental issue. So over the past several years, we've been working very hard to take a look at the images that we utilize in the publication in response, and also in the words. And it has been a journey. It's been a very challenging yet rewarding opportunity to publish this, as we learn how to identify imagery that is more encouraging and more hopeful, and also finding words that some people struggle with, trying to talk around those words, and maybe they don't quite understand the subject matter that we're approaching. But we look at it from a point of view of trying to bring an educated community together, because each one reach one. And we know that some people are just focused on their individual preference or outlook, and so our goal isn't to make everybody turn around and recognize that alcoholism and drug use is a disease, but with compassionate and caring language and hopeful and encouraging graphics, we hope to bring people along to the mindset that this is more of a community issue, and in stigma reduction and also harm reduction, trying to get more people involved with the impact of how this misuse affects everybody within a family and everybody within a community. And so with that, we've had the opportunity to do the response. And I think, Marcia, at this point, we're going to tee up one or two of the last issues that we worked on, just to kind of talk about how we arrived at some of the concepts, and how we looked at those images in the initial design. And as I say, working with my team, the designers and so forth, just trying to really be more responsible and thoughtful with regard to the imagery that we picked. And so thank you, Laurie, teeing this up. So this is, I think, one of the last issues that we produced. And if I'm correct, these are covers that we had produced. And so looking at this first cover presentation or concept, if you will, we arrived at addiction lives in every neighborhood. So the struggle was, how do we define what that neighborhood is, or how do we define, get the message across? And one of the things that really stuck out with the editorial team in looking at this cover was, it almost looks like the graphic is saying the problem in our neighborhood is Reading, Pennsylvania. Very stigmatizing, as is often the source of bad press, bad publicity, the city of Reading, but addiction truly lives in every neighborhood. So our point was, this cover, while it might be an attractive cover, certainly serves to stigmatize the community within the city of Reading. So the next cover was another one, and moving along, we kind of said, hey, maybe it's addiction at the crossroads of addiction and recovery. So we're bringing both together to say that they go hand in hand, or we hope they do. And addiction lives in every neighborhood. In this case, letting people know that we're talking about all communities, and being a Berks County publication, all communities within Berks County. So obviously, big map, can't put everything in there, but to give the sense that we are talking about the broader community. I think in the next, then we went to a third cover. I think we have a third cover up. Yes.
Yeah, this is a good one.
Yep, that's all right. And so this was a cover idea. In looking at this cover idea, addiction lives in any neighborhood. While it's a true statement, war on drugs sort of brings us back to the stigma that it's a war. And we really wish to remove that. And so in stigma language, war means it's something we're fighting, and we really want to focus more on the recovery, more on holistic language that gets everybody thinking in regards to family and hope and health, as opposed to a war, because the connotation war was how many people can we send to jail, and back to the criminalized behavior and the thought that it generates immediately to drug dealers on the street and broken needles in the street and empty liquor bottles. So I think, is that the third one, right? And so in moving through those, we have essentially settled on the one that had the map that portrayed the entire community and pulled out some of the larger cities or towns, so that the topic is at the crossroads of addiction and recovery. That's in every neighborhood. It's a main street in every neighborhood. And then obviously opium to fentanyl and some of the content that we include in the different magazines. Marcia, comments that you have in this regard?
Well, I think for us, it was a very team building journey, because we all had to look at not only the visual, but also how all the articles were written. And so we saw a lot of references to the word addict, and it kept being reinforced. So not only working with the graphic designers at Hoffman Publishing that did a great job of retooling as we needed to, we had to also work with our writers to be able to have them, and they all came from a different perspective. So we're still on this journey now. This is only the beginning. As I said, when I did the introduction, it's been a long time with this kind of language. We feel we made progress, just as Dr. Murphy pointed out the progress she was able to make at Penn State Berks campus. But we need to be able to now have you as team members be able to take the information we've shared today, look at how you can apply it in your practice, and how we can get this information out. So as we intersect with the community, it requires all of our efforts to make the changes. So I think we're at the point that we need to close, and I want to turn it back over to Laura. And thank you very much, presenters.
Yes, thank you. That was really interesting to see the covers, I think, to see how one could be more stigmatizing than was intended to be. And we will be mailing out hard copies to everyone of the toolkit that Jen had showed you earlier. And we'll also follow up with an email. So if you don't get to do the survey now, or you don't get the link to the SOS Berks response, but Jen just did put it in the chat. But we can follow up with an email, okay. So you can do it then. So if there's no more questions or comments. Yeah.
So if I could just challenge us all one more time, Laura, that as part of my journey in recovery, one of the things that early on I had to teach myself was to unlearn. I had to unlearn all the negative images and thoughts that I had about what addiction looks like. I had to unlearn all of the language and the degrading words that I would give to myself. And I had to change that scope so that I could feel better about myself, so that I could give myself that fighting chance that I deserve. And so I just challenge us all to unlearn those unhealthy images, unlearn those words that can be really stifling and stagnating, and really distance ourselves from helping individuals. And I just challenge ourselves to unlearn that addiction is something of a moral failing, and learn that it is a disease that is chronic, progressive, and potentially fatal, and that we have an opportunity to change the scope of the world and the lens of how we see people living with substance use disorders.
Wow.
Very well
that's
said,
great.
Yvonne.
Yeah.
Thank you, Yvonne.
Yeah, thank you. Yeah, that was a very good point. All right, anybody else have a comment? No? Okay, well, thank you so much, everybody, and thanks to the presenters. We really appreciate your being here today. Bye now.
Bye-bye.